coach. This week assignments was to design a warm-up, resistance training and conditioning session for a 70-year-old man who just had a knee replacement 2 weeks ago. So we wrote some notes, and the first thing we should watch for is that on this workout we should be really careful with whatever we prescribe due to the age and the present physical conditions of our client. Since he had a knee replacement 2 weeks ago, none of the exercises can be too mobile regarding his lower body. The load on this workout will depend on the condition of our client. It really depends on what he can do, because some 70 years old can do even better than a lot of 25 years old around. All exercises on this workout can be performed either with a resistance band or dumbbells. So it depends on the load it depends on the level of how much we want to push him. Due to the physical condition of our client, we should give even more attention to his form. So for the warm-up, he will perform a series of exercises, 10 to 12 reps each. The first one is reach up and down with the arms.
Nice.
And then reach side to side with the arms. It can be faster or slower depending on our client. Third one is lift arms up and down. Make sure don't ultrapass the shoulder line. Fourth one is hip rotations. He can put his hands on his waist to better form. And then hip movement side to side, same thing, hands on his waist. Then calf raisers, ankle circles, and shoulder rotations. Then he will perform a series of active stretches, starting with bicep stretch and then tricep stretch. He perform 10 reps each, so to be active and stretch at the same time. Quad stretch, both legs, and of course with his knee problem,
you can switch.
You have to get a wall so he won't lose balance. And then, if possible, he will bend his knees and reach his toes.
Nice.
So for the resistance training part of the workout, all exercises should be performed with a 30-second rest or no rest between sets and supersets. So the load for these exercises will depend on our client. He can even choose a resistance band that has a lot of resistance, or he can do it with dumbbells, or the load will really depends on what he can do.
I'm 70 years old. I choose rest. I'm not
So the first superset is bicep curls with resistance band, or again with dumbbells.
Good job,
3 sets
strong
of 15
man.
reps. And with that, the second exercise of this superset is leg press, with resistance band or on the machine. So 3 sets of 15 reps. So the second superset, the first exercise starts with triceps with resistance, or again with dumbbells. 3 sets of 15 each arm. And make sure that the client is not forcing too much, if there is not too much resistance. So be sure to be close to him and be talking to him if how's he feeling about the exercise. Second exercise of this superset is single leg abductor.
Keep your balance.
With resistance band. 3 sets of 15.
I don't care.
So make sure that he's keeping his balance and that he can do this alone. Maybe he will need a support of a wall. First exercise of this superset is single arm lateral lifts with resistance band or with dumbbells.
Nice.
Again, 3 sets of 15
Keep your wrist
reps.
straight.
Make sure that he has his
Like, no, like
wrist
this.
on the right position. He has to be a straight wrist.
Yeah.
And if he cannot perform a lateral lift, he can also perform front arm lift. Make sure you do both arms, 3 sets of 15 reps. Along with the superset, we have curl-ups, 3 sets of 15 also. For this superset, we have elbow rotations with resistant band, 3 sets of 15. Make sure that he's performing it with a towel or something that he can hold on to the elbow. So we make sure that the elbow will be close to the body.
Nice.
He brings inside and outside.
Go.
Second exercise of this superset is calf raises. It can be performed on a step or without a step or even in the machine. 3 sets of 15.
So for the conditioning training part of our workout, will be the last part of this workout. We will need an exercise ball or a medicine ball, depending on our client's capacity. So these exercises will require close attention of the fitness supervisor because of the physical condition of our client. So he has a knee problem. So we have to really watch for his form, and because he won't have balance at all. So we have to watch his form and make sure he's comfortable with all the exercises that are being performed.
So the first one is trunk rotations. He will touch the wall and give the ball back to the fitness instructor. So he can do that on faster or slower depending on the client. The second one will be passing the ball. It can be performed with the exercise ball, and he can let it bounce or not. So that will depend also on the reaction time of the person who is doing it. The third one will be shoulder press. You can do single arm or both arms at the same time. And last one will be glute bridges. It can be performed on the ball or on the floor.
So for the stretching and cool down, in this case our client won't have balance because he had a knee replacement 2 weeks ago. So due to the possible lack of balance of our client, we should help him to stretch. Maybe make him lay down on the floor and just stretch, carefully stretch his legs and do some other kind of exercises where he can stretch good and cool down, and he will be ready to go.